3, 2, 1.
Okay. Hi, my name is Ian. I'm your nurse instructor for today. Today I'm going to teach you how to properly wash your hands. Hand washing is very important because it is a key part to stop the spread of germs within the hospital setting when nurses, doctors are talking to patients and making sure that that infection control takes place. First thing we want to do when we wash our hands is to turn on the sink. This is an automated sink, but normally we'll turn on the sink and make sure it's heated up so you work with hot, foamy, soapy water. So first thing we're going to do is we'll get our hands wet. It's also worth noting that we are going to be cleaning 1 inch above the contaminated area. For this demonstration, my hands are the contaminated area, so we'll go 1 inch above our wrist. You also want to make sure that our elbows are always above the hands, making sure that the water goes down our fingertips. So now that we have our hands all washed, we now grab the soap and we use the recommended supply amount for each soap brand. Each soap brand is different. For this one, it's 2. So then we start by rubbing it around our palms first. Then we make sure we hit every crease and crevice of the hands. Again, making sure we get above 1 inch minimum above the area of contamination. So that being our wrist for this one again. It is also worth noting that this spot of the hand is usually the most contaminated just because we tend to forget to wash it. So you gotta make sure you get that part, get in between the fingers, going away down the fingertips. And another important thing is we got to make sure we get under the fingernails. So the way we do that is if we have a fingertip helper stick, then we can use that. But for this case, we just use our fingernails. So one really quick last scrub through. Then, again, keeping our elbows above the hands, washing off all the soap. Every area. Yep. Okay, now that the soap is now off, now we grab our paper towels. Now it's worth noting that we pat, do not wipe, and that we just go from fingertips down. Now to make sure that we do not contaminate ourselves by going back up, we can grab more paper towels. And start from fingertips down. Patting, not swiping. Then we'll grab our paper towels. Though we have an automated one, normally if we have a sink with handles, we'll use the paper towels to turn it off. But then we just throw away our contaminated rags. And now our hands are clean and we are ready to operate on the patient.